Deukmedjian. It's April 23rd, 2026. We're broadcasting live spine surgery, laser spine surgery from Deuk Spine Institute here in Florida. Our patient has 3 herniated discs in his neck. He's had pain in his neck for 8 years. It's been debilitating. Other doctors would recommend a fusion, but he didn't want a fusion. He wanted to have movement of his spine and his neck at the end of surgery. So laser surgery was the best option. This is endoscopic laser spine surgery. We're fixing 3 discs. Our patient is asleep. He's intubated. He's relaxed. Shot. 2, 3, 4, 5, 6, 7. You agree, Luis? Shot. Jordan. All right, AP. We've done now 2,753 of these surgeries. This will be 2,754. Perfect. You can see the needle tip is exactly in the center of the spine. That's where we want it. Shot. 2, 3, 4, 5, 6, 7. Shot. Shot. We're doing 6, 7. Everyone agree? 2, 3, 4, 5, 6, 7. That's 6, 7. Jordan, you agree? Shot. Hold on. Shot. AP. Quick AP right there. All right. That looks pretty good. We try to get his neck straight, Berndes. So give me a coker. Shot. Shot. All right, let's count. C2, 3, 4, 5, 6, 7. Everyone agree he's at 6, 7. We're at 6, 7. I need a AP view. I'm going to place it 4, 5, right? We're doing 4, 5, 5, 6, 6, 7. Everyone agrees? All right, give me a nice AP. So get those spinous processes centered. We want to know where this needle is. Keep going a little bit more. It looks almost perfect. Yeah, it looks really good. So it looks like we're going into the disc right in the center and coming off to the right side just a little bit. His arm symptoms are primarily right-sided. Shot. All right, let's go back to a lateral view. You have another needle? We're doing 4, 5, 5, 6, 6, 7. You have a shorter needle? That's my view right there. 2, 3, 4, 5. So I'm going to place a second needle at C4-5 disc. That way I'll have C4-5 tagged, C6-7. I'll start with 6-7, and then I'll do 5-6, and then I'll move up to 4-5. But that way when we start 4-5, I understand why you wouldn't have a short needle ready. No. So why'd you have 2 needles then? That doesn't make sense. Shot. 2, 3, looks like 4, 5. Yes. Shot. AP. AP is a front-back x-ray rather than a side-side. These are side-side you're looking at. We're going to go to a front-back. That looks really good. We're in the middle of the disc where we want to be. We're going to enter between the longest colli muscles along the anterior longitudinal ligament. Shot. Okay, 2, 3, 4, 5. Jordan, you agree? 4, 5. Shot. All right. Shot. Shot. Let's go AP. Coker. And I want to look at 4, 5. Any questions? Feel free to type those questions up. Looking good. That looks good. All right, let's go back to 6, 7. We'll do our discogram. We can shoot that discogram shot. Oh yeah, look at that. That's a big tear. Let me shoot the 4-5. In the meantime, we'll get our laser fired up. Any questions? Shot?
No current questions.
All right, give me an AP. If you have questions, type your question up and my team will ask me and I'll answer it for you. Looks good. You can see the tear. Jordan, show the audience the tear in the back of the disc. Show from where the needle is. There's tears on both sides at C4-5, right and left. You can see the dye leaking out into the foramen, filling the foramen, and circling around the nerve root. And look at 6-7. Again, also dye. The dye is already gone, basically. The body absorbs it pretty quickly. Gets absorbed into the bloodstream. I'm making a 4mm incision. The entire surgery is done with a 4mm incision. In his case, since he has 3 herniations, we'll be doing 2 4mm incisions. I've already made a 4mm incision. This surgery is done without bleeding, without hospitalization. This is outpatient. The patient will go home an hour after their surgery, and we'll see them back the next day for a quick checkup. This is the future of spine surgery. You're watching it today at Deuk Spine Institute. Sean, give me an AP. Deuk Spine Institute is truly the leader in the world with the best results, with success and low complications, fast recovery, and durability. Our surgery, we looked at patients 6 years after their surgery, inline traction, and those patients that had the surgery 6 years ago, shot, yes, they have still 92% of their pain is gone that they had before surgery. So 6 years after surgery, 92% of the pain gone on average for the patients with the Deuk laser disc repair. That's actually the longest long-term data I'm aware of in medical literature for this procedure, for any endoscopic procedure on the spine and any laser procedure. So Deuk Spine Institute is leading the world in long-term relief of pain with our laser surgeries. We are also leading the world in the least invasive incisions, 4mm, the fastest recovery, 1 hour on average, and the lowest complication rate, surgical complication rate. We've had 0 surgical complications with this surgery done in 2,753 now. This is 54 patients. All right, that looks good. We're going to take the dilator out. You can all see here there's no bleeding. We have literally half a drop of blood. It's like you get more bleeding when you shave yourself. And we're going to go in and fix the first disc. Number 6-7. Any questions?
No current questions
All right,
at this
in that
moment.
case, let's go ahead and show the audience the 30 different causes of neck pain. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury, to the capsule will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. So the adapter on the machine was damaged, right?
Correct. There is a splitter box within the machine itself that needs to be replaced.
Yeah, but was it, could it be like wear and tear related?
I believe so, yes.
So then I asked Monica to get a short cable, plug it into that adapter, and then you plug this cable into that cable. Is that what we did? No? Why not? Huh? All right, hang on a second. All right. Where is it? Where's the adapter? Where's the cable in the fluoro? Okay. Just, yeah.
Was what was causing the issue.
Uh-huh.
There is a box inside there that's
Yeah.
a
Do you ever unplug that?
This one?
Yeah.
Only when I move it back and forth. And you can
Right, so every day you unplug it.
pretty much.
We don't want that. We want whatever's plugged in there to never be unplugged. And that this should then plug into a short cable that connects to that. Do you
Okay, so just,
understand?
so a permanent one there.
It is your wiggling that made that fail. And every time you unplug it, you wiggle it, you're making it fail. It may take 100 wiggles, then fail. 100 wiggles and fail. We want 0 wiggles. The way you do that, you get a short adapter cable, plug it in there, never take it off, tie it down, tape, so it never moves. And then this end of the short cable, you plug that into this end. I told Monica to do that. Did she not tell you? Find out why she didn't tell you. I don't want to keep having the same $3,000 repair every 3 months, okay? The way you prevent that is by figuring out what's causing the problem and fixing it. And that's what I told Monica to do. Find out why she didn't mention that to you. Have her come talk to me because I don't understand. Maybe if it came out of her bonus, she would have taken care of it. Right, Berndes? What do they say? You gotta hit 'em where it counts. Otherwise, people don't care. All right, let's show the audience why herniated discs can become so painful to people.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. Now let's show the audience how we fix this pain that comes from a disc injury, like a herniated disc or bulging disc.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our videos that disc herniations, disc bulges, disc protrusions, any kind of disc issues can actually be very painful through a process of inflammation. The best treatment is to go in and repair the disc with a laser called the Deuk laser disc repair treatment, which is done here at Deuk Spine. And other options include fusion. But who wants a fusion? Nobody. Nobody wants a fusion. Look at this piece of herniation here. Just sitting there. This will be the last piece of herniation on this disc. Then we're going to move from 6-7 up to 5-6. Any questions from our audience?
No current questions.
Are you sure you're streaming?
Yes, I am.
Where are you streaming?
Facebook, YouTube, Instagram, X, and LinkedIn.
Have you gone on Instagram and seen this live stream working there?
Let me check right now. Yeah, I see it.
So, the live stream is definitely on Instagram. Is that correct? You're seeing it?
Yes. Wait a second.
Have you gone to X and verified that we're streaming on X?
Let me go on X right now.
I'm sorry?
I'm going on X right now.
I see it on Facebook.
So
Yeah, we're
Bernadette
streaming.
verified Facebook.
So you got Instagram, Facebook.
You verified LinkedIn. Is that right?
Yes, I did.
And Bernadette's verified Facebook.
So we have 5 people watching currently.
5 people watching where?
4 on YouTube and now 2 on Facebook.
Got it. Well, one of them must be Bernadette's.
Yes, correct.
All right, so Anthony, did you put this surgery on the schedule on the website?
Yes, I did.
When was it put on the schedule?
Should be Friday.
All right. I just want to make sure you're putting the surgeries on the schedule on Friday. You are?
Oh, yes, I am.
All right, good. So if somebody were to go to our live stream schedule, they would actually see, oh, look at that piece of herniation. They would see it.
Oh, yes, they would, yeah.
They would see this surgery and now, I mean, I know you modified it, but there's 2 surgeries we're streaming today. The cervical DLDR and the lumbar DLDR.
Yes, I had all 5, but I will remove the other.
There's not 5. Oh, you're talking about the piriformis and SI being separate.
Yes, that's why. Yeah.
Understood. Yeah, that's the right thing to do. But yeah, we're not going to do those cases in the recording room. We're not going to be able to broadcast them.
Oh, okay.
We're just going to be streaming 2 cases today, and that's the 2 DLDRs.
Okay,
2
sounds
laser
good.
surgery cases. All right.
I will remind him next time.
I'm sorry?
I will remind him next time if we do cases
Yeah, thanks. All right, just about done. I need about another minute.
I saw the live stream scheduled on your website.
Is it working?
Yeah, I was just looking at it.
All right, good.
Yep.
That's what I want to know. You know, with Henry gone now, it's,
Do you have a search bar on your website, like a little looking glass?
I don't know. Why don't you tell me? Do you think we need something?
Yeah, maybe because some people can type in specifically what is ailing them, and it can pop up really quickly.
So you're saying we don't have a search bar on the website?
Sorry, I didn't notice it, but you're right. I just was,
We might not.
I was looking, I didn't see it.
Find it? See if you can find it while you're here. Man, look at all this herniations. See if you can find it. If you cannot, do you have Son's email?
No,
You don't have Son's email? Should.
no, maybe, I might just be missing it. I just,
I'll bet you it's there. Because I know for sure
sometimes it's hard to pick stuff up on a phone too.
No, it's not. Our website is responsive. It's supposed to be able to go to a phone and produce the exact same content.
A box with a looking glass.
Well, just type in SU on your address bar for an email. Go to compose an email
Okay, I'll look at that.
and type in SUN and see what comes up. Man, there's a lot of herniations here at 6-7.
Yeah.
Did you get it?
I'll send an email right
So you got her?
Yes.
Just say, Dr. Deuk told me to email you. There's no search feature I can see on the website. Oh yeah, look at that thing. That thing's a big piece of herniation right there. Grab her. Look at that piece of herniation. Are you here on the camera?
Yes, we are.
Let me do it. It's right here. Right
Yeah, we
here.
see the herniation.
Can you see this piece of herniation? Put it down.
Yeah, on the probe, on the grabber.
Right there. You
yes,
see that?
we do.
Yes?
Yes, we do.
All right. That should be the last one. Oh, there's still one more there. Look at that thing. It's calcified. You can see the golden color. Very scarred up. I'm having to use the laser on it because the flow is not pushing it all the way out. There we go. All right, we are done with 6-7. Let me just take one more peek here. A little bit more right there. One more piece. Pretty good size there. Any questions?
We have no questions, but we do have a comment from Kim H on YouTube.
I can't hear you. Your voice is too low.
We have no questions.
Still too low.
We have no questions, but we do have a comment from Kim H on YouTube.
Sure. A little bit louder.
Okay. So Kim H commented, "You are streaming, LOL."
I couldn't hear you. You're going to have to speak up or you're going to have to turn up your volume there.
Can you hear me now?
Again?
Can you hear me now?
You know how to turn the volume up on your mic there?
Yeah, I can do that. Give me a second. Can you hear me better?
No.
Can you hear me now?
Again?
Can you hear me now?
No, you've not increased the volume of the mic at all. All right, lights on, let's go.
Son responded she's gonna look into it.
Thanks. We're going to move from the 6-7 up to the 5-6.
No. You read that? Oh,
Yeah,
you want to jump
yeah,
on?
yeah.
Okay.
I'm going to move up. Watch the fiber there. It's going to break. If something hits it, pull it back. Come on in. All right, where are we at here, Anthony?
Hello. So we
Still
have
lateral.
a comment from Kim H on YouTube.
Your voice is still not loud enough. I can barely hear you.
We have a comment from Kim H on YouTube.
Okay?
Is that an unusual amount of herniation or scar tissue?
Yeah. So Kim, I agree with you. I think it's on the higher end of herniation. There were so many pieces. You could see that there were chunks. Those chunks are basically piece of herniation that over 10 years has become attacked by the inflammatory system, scarred up. We call them collagenized pieces of herniation. All right, I'm going to move to shot. I'm going to move up, don't touch that, to the next disc. To do that, I've got to take this dilator out and move it up. Shot. AP. So as I move up the spine to the next disc up, 5-6, I'm going up one disc from 6-7 up to the 5-6 disc. Shot. This is the Deuk spine shuffle, we call it. Shot. All right. Big bone spur. Shot. Shot. AP. Looks good on the lateral view. I have to verify on the AP view that we're in the middle of the spine. A little bit off to the right. Stay there. Shot. That's good. Lateral. Shot. Shot. Okay, we are inside the disc. Shot. Go ahead. Shot. So we've already shown the 30 causes of neck pain. Shot. Look at the tear. You can see the dye escaping out of the disc through that tear. Shot. Shot. That tear is what we're after. You're a little off on orbit there, buddy. Can you see that? Shot. Go ahead. Shot. 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 So, shot? Yeah, I actually agree with the comment made by our viewer that there was a lot of herniation there. And it was all very old, scarred, calcified, dense, weighing down, sinking. Did not want to come out. It made it very difficult for us to do. Come on, Jordan. Jordan, you got to learn to do two movements at the same time. You know what I mean? So, no, it's what? Yeah, so as you're going from, side, you want to rotate the arc as you're pulling backwards. That way you don't do linear one then the next. You got to do it all together. Every second counts when a patient's under anesthesia. All right. Again, same problem as the last disc. Bone spurs, calcified, dense herniation, fragments. You can see them. Here's bone spur being removed with the laser. That laser is extremely precise and powerful. It can remove bone spurs very easily. People ask me about that all the time. Dr. Deuk, the laser can remove bone spurs, absolutely. But I'm not going to take away every bone spur in your neck. There's no reason to. 90% of bone spurs don't do anything. They just cause no problems. You leave them alone. By going after them, you create the higher risk of complications for the patient, which we don't want. We don't want any complications. The goal of surgery is not to get rid of bone spurs. The goal of surgery is not to make your spine look normal. The goal of surgery is to get rid of symptoms like neck pain, arm pain, weakness in the arm, numbness in the arm, spinal cord compression. Those are the goals of surgery. Nerve root compression, headaches that come from the neck. Those are the goals of surgery. Yeah, this patient has some very degenerated discs. For years I used to do fusions, and I would take a drill to this ledge of bone spur, because there's really a ledge that forms at the back of the disc with the superior end plate right here. You guys see what I'm using the laser for? I used to drill this off with a drill. If you go back and watch my ACDF surgeries on YouTube, you can see me drilling this with a 3mm neuro bit using a pneumatic drill or electric drill. Usually electric. Pneumatic drills are older. We don't really use them anymore. Now I can do it all with a laser. You don't need a drill. The laser is actually safer, and you see the visibility is far better. All right, I'm gonna turn. Any questions from our audience?
Currently, no questions.
All right, we've shown how a herniated disc causes neck pain. We've shown how the Deuk laser disc repair treats painful discs to get rid of pain.
Yes, we have.
And we've shown the 30 causes of neck pain.
Yes, we have.
Why don't we show the audience the cervical Deuk laser disc repair and why
Okay.
it's better than other treatments. I
Okay.
think that, I don't know the title. Why don't you read me the title so I can help guide you?
Deuk laser disc repair versus all invasive.
Yes, that's the one.
Okay.
I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm. alarm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatment such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones, such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease, very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs. Lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work, they're dangerous, they put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're gonna have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active. End the video early because I want to show you, look at all the inflammation, the pink tissue, everything is pink. And then you got blue, which is herniation. The pink is inflammation within the annulus. Look at that herniation right there. I think this disc was causing most of the patient's neck pain. The other two discs were definitely a problem as well, but this I think is the acute pain, the pain that he's been having more recently, because this is a new herniation. It's probably about, I don't know, maybe a year old or 6 months old. Definitely a problem. Any comments or questions from our audience?
We have 2 questions from Kim H on YouTube.
Tim H. A little bit louder there, Anthony.
Okay, the first question is, was this patient close to being paralyzed from the excessive amount of herniation?
So the question from the audience, was this patient close to being paralyzed because of the herniations in his neck? The answer is, I don't think so. I don't think he was that myelopathic. I think this was more a neck pain issue. He presented with horrible neck pain. He couldn't live life like this. His options were a fusion, ACDF, which is highly invasive and dangerous, and to be honest, completely unnecessary because we can fix the disc with laser. So he chose to repair the disc rather than remove them and fuse his neck. The fusion patients typically have lots of problems after fusion: stiffness, pain, they have trouble swallowing. That swallowing trouble frequently lasts the rest of their lifetime. They can't swallow solids and liquids normally. But with the laser surgery, we've never had those problems in 20 years of doing it. Also, the recovery for fusion is on the order of months or years. With laser surgery, our patients are recovered within an hour. They're going home. Of course, they have some restrictions, not doing any heavy lifting. This disc right here, C4-5, look at all the herniation, the blue stuff. That's what I'm removing with the laser. So the other 2 discs were more degenerated. This is more herniated. Now this herniation will become degeneration over time. If we didn't fix it today, these discs, this number 4-5 is going to degenerate and collapse, become dark, become more inflamed over years and years after the injury. So I think this is a newer injury for the patient. Grab her. Any other questions?
We have one more question from Kim H on YouTube.
Yes.
And was this herniation caused by an injury?
You need to be a little bit louder. You're going to have to find that volume control. I don't think you fixed it yet, Anthony.
Okay.
Turn the volume up a little bit.
Can you hear me now?
Yeah, it's a little distorted, so move your mouth away.
Okay. The question is, And was this herniation caused by an injury?
Was the herniation caused by an injury? The answer is yes. Every herniation is caused by an injury. You cannot have a herniation without trauma, injury to the disc. So every single disc herniation, disc bulge in the world is due to trauma to the spine. Herniations don't just happen. They're not like wrinkles that just happen as we get older. They require trauma, some type of force on the disc where the ligament that holds the top bone to the bottom bone gets broken. It gets ripped right open. And at the same time, the nucleus pulposus is crushed and fragmented into little pieces. And those pieces then start coming out of the annular tear. And they're responsible for the herniation. There is a lot of herniation here. I'm pretty amazed at how much herniation is here. This is one of the worst I've seen, and considering the number 5, 6, and 6, 7 are so degenerated, they didn't really have a lot of new herniation. This disc has a lot of new herniation. This patient's pain probably got worse over the last year due to this C4-5 herniation. Any other questions?
Currently, no questions.
All right, good. We'll be wrapping up the surgery shortly. The amount of fragments are unbelievable. Thanks for joining us. Wow. All these pieces coming out, folks, are pieces of herniation. Every one of them. And they're either scarred up like this right here, this white stuff, from inflammation, his body attacking it for so long, trying to get rid of the herniation. Or they're scarred or calcified pieces of herniation. Wow. All right. See all the gold color? That's calcified. I don't know. This fiber, not great. You guys see the PLL there, posterior longitudinal ligament? Are you on the scope right now?
Yes.
The endoscope?
Yes, we are.
I don't know. Can you tell me about this fiber?
I mean, this is what's new actually.
Are you sure?
Quite intellectual. Yeah, I mean, it's
Could it be the interface?
we always make sure everything is good there.
You see what I'm talking about? It's just,
You wanna is able to increase the power a little bit more? Or?
yeah.
Can we increase the power a little bit more? Maybe from 2.5 to maybe 3. 1 second. 1 second, doctor. Go ahead. Ready? Ready? Good.
No.
You have about 10 minutes left, dude?
No. About 3 minutes, 4 minutes, 5 minutes, somewhere. You know? Jesus Christ.
Usually we're gonna bring the patient back to the other. When he said okay. Yeah. Help Hector position.
On who?
Probably the third patient.
All right. Yeah, done.
Okay, senior now, please.
All right, we're done, folks. Irrigation. That was the worst herniation, for sure. Any questions?
Yes, we have 2 new questions from Kim H on YouTube.
All right, go ahead.
The first question is the new herniation of C4-C5 due to the degeneration of the other disc?
So great question. So Kim is asking, is the herniation at C4-5 due to degeneration of the disc at C5-6, C6-7? No, it's not. It's due to trauma, a new trauma, maybe more recent, which is why that disc is not degenerated. It's really a newer herniation within the last couple of years. All right, folks, there it is. 4mm incisions, 1, 2. We fixed 3 discs. We probably could have fixed all 3 with 1 incision, but I wanted to play it safe and make sure we're able to get this done safely. But this patient's going to wake up in a few minutes and basically go home in an hour. Tomorrow he'll come in for a quick checkup, 15 minutes, and then get on with life. There's no therapy after our surgeries, just walking, exercise, and some minor restrictions with lifting. Hope you enjoyed it. Let's play for our audience a nice testimonial from a cervical Deuk laser disc. And good morning, I'm Dr. Deukmedjian at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4mm. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then.
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff stuff backing your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck and it was really bad. I would turn my head anyway and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk laser disc repair and the Deuk plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.